All right, we're going to demonstrate wound care and hand washing with multiple wounds. So we're starting with clean hands. We've already done our soap and water clean. We've already done our bag technique. And we have laid out all our supplies using clean hands and clean technique to open the packages. Everything that's been placed on this surface has either come out of a clean bag or has been wiped down, such as the gel, the pen, possibly the scissors. And we have enough gloves for 2 dressing changes. We have 2 wounds on Robin's arm. There's one here and there's one there. So with my clean hands, I've just washed them. I'm going to take off the old imaginary dirty dressing, pick it up, ball it in the palm of my hand, and then I'm going to wrap it up in my glove and discard. If it's too big to wrap in the palm of your hand and inside your glove, you're going to discard it in an OSHA safe receptacle, which is a double bag, plastic bag receptacle. So I have discarded the old dressing. I'm taking out my gel. In between glove changes, you're going to use your gel for about 15 seconds. A nice vigorous rub. I'm going to don my clean gloves. Saline. This should always be dated too, so remember you've got your pen here. Let me back up a minute. You need to measure. We've got the wound exposed. So we're going to either use our tape measure and measure the wound with our pen that we have wiped off with alcohol before we laid it on our wound care surface. And we've got some paper towels here so we can write down the measurements real easy. If you don't have this, you can use these if you have these, and if these are clean enough out of a bag, you can actually lay it on a wound, but it might be more prudent to just lay it over above the wound so that you're not taking any chance of contaminating the wound. If you're using this, don't measure the wound and maybe touch it and then do that. If you've measured the wound and you think, oh, I've touched the wound, lay it down on your surface because you need to clean that with alcohol before you wrap it up inside again. Same thing with dressing. Scissors, if you have between wounds you're using to cut off the old dressing, you want to make sure that you're cleaning that off with alcohol prior to doing the next dressing. So I've done my measurements, I've written them down. I'm going to put a dressing on here. That's my first dressing. I'm going to remove my gloves, go to my gel, I'm going to put on fresh gloves to remove the old dressing on the second wound. So imaginary wound, remove the old dressing, discard, gel again, between glove changes and between multiple wounds. So I've gone from clean gloves to dirty gloves, gel, and a fresh set of gloves. Laying the dressing, measured it, placed in your dressing, take your gloves off, gel again, and you're done. Remember, you're always dating your saline, and if you have contaminated, anything that you use to measure the wound, you're wiping it off with alcohol before you retract it. These are disposable. Put them right in the OSHA bag, double wrapped plastic bag. Your scissors, as I said in the bag technique, if they're grossly contaminated, wash them off with soap and water in a bathroom sink. Wipe down the sink to be nice to the patients, and then wipe them off with alcohol before you put them back in your bag. Same thing with the pen. Wipe it off before you put it back in the bag. Same thing with the gel. Any supplies that are going back into the patient's bag, make sure they're clean going back in. If you need to wipe off the saline because you think you might have contaminated it, wipe it off before you put it back in the bag. If you think maybe the tape became contaminated, you might need a new roll of tape. It's hard to decontaminate these. So basically you want to making sure that you're keeping 2 wounds separate. It's 2 separate dressing changes if you have 2 separate wounds. And you want to make sure that the surface is clean, everything is wiped off before and after.